Okay, here we go. All right, so welcome everyone to our second Personal Perspectives panel webinar. The first you might have seen in December was related to cardiac surgery, life after surgery. Was super well received, and we are thrilled to be able to continue this series partnership as all of our divisions, the Marfan Foundation, Loeys-Dietz Syndrome Foundation, the VEDS Movement, and then of course the GenTech Alliance. Although for the sake of tonight, we're mostly talking about the three condition-specific divisions, looking at maximizing doctor visits. And this topic comes to us because we hear a lot from folks about, you know, how do I make sure I'm getting all the right questions answered? How do I make sure that, or how do I help my doctors talk to one another? When you're in when you have a condition like one of the connective tissue conditions that we work closely with, there are so many specialists you're working with, and whether you are a parent trying to advocate for your child, you are yourself affected by the condition, you are a friend of someone who's affected by a condition, or maybe you wear multiple of those hats. And in the case of our panel tonight, we have two folks who are also medical professionals, one being Gretchen MacCarrick, who is our beloved rock star in the community, friend to all, genetic counselor with Johns Hopkins. She will be our moderator for tonight, or moderator, sort of our lead on the night. And as always, the wisdom that we all seek. She said she's afraid she'll say the wrong thing. I said, I don't think it's possible. Then we also have Andrea Whitty, who's joining us. She has a Marfan syndrome diagnosis, and I'll have the four of you introduce yourselves here once we get through these slides, so you can say hello face to face with everyone. She's also a clinical researcher, and I asked her before we started here, I said, how would you describe where you are at in your medical school path? And so we decided on aspiring medical student, definitely has a heart and interest in helping others along similar paths that we're going to talk about tonight. Then we have Abby DeLong, who is a parent of a child with VEDS, diagnosed in 2012. Is that correct, Abby? Is that right? She's given me sort of a maybe face. So she does serve as a major asset on the VEDS steering committee, and we're so thrilled to have her years of wisdom, specifically from a VEDS lens and that of a parent of an affected child on the panel tonight. And then we also have Courtney Jensen, also a genetic counselor affected by Loeys-Dietz syndrome, genetic counselor at Duke University. I just learned, I was reading back through my notes today, and I'm excited to have Courtney here specifically because there were a few questions about kind of transitioning from pediatric to adult care, and Courtney talks a little bit about emerging adulthood and like where that takes us, and how there are some special needs for the folks who are going through that. And we hear that both from the emerging adults themselves and from parents who are trying to help their emerging adults make that transition. So welcome to all four of you. I also want to give a quick shout out to Jan. Jan Lynch, our on-staff nurse. She is, if there's ever been an embodiment of the salt of the earth and a human being, it's Jan. Like, just one of the most beautiful souls you will ever meet. Loves working with our community and helping in any way, connect to resources, kind of helps put puzzle pieces together a lot for folks. So it fits really nicely with some of the questions that were asked that we may not get to tonight. So if you have a question that you really want an answer to and we don't get to it this evening, please do contact Jan. The easiest way is to go to marfan.org/ask. There's also loeysdietz.org/ask, and I think the vedsmovement.org/ask. They all go to Jan, and if she doesn't know the answers, she is a master at connecting to the people who do know the answers. So with that, I'm going to bring us back to our panelists. Welcome, and we'll get started with Gretchen. Would you like to just say a quick hello intro? And then as each of the rest of us have a moment to speak, I should probably introduce myself. I just jumped right in. Hi, so I'm Angela Christ. I have been with the Marfan Foundation for about 2 years. I am the Director of Marketing for the Marfan Foundation, and then in July was also asked to help lead the Loeys-Dietz Syndrome Foundation when that became a division of the Marfan Foundation. So I wear a couple of different hats, but I love them both. I get to meet so many wonderful people, including these panelists that we have in front of us here tonight. So with that, then I will hand it over to Gretchen. And if you want to say a quick introduction, and then I will serve up our first question. And then as the other Courtney, Abby, and Andrea, as we get to you, you can kind of do a quick intro of yourself as well as as the question circles to you. Does that sound okay? All righty, Gretchen.
Great. Well, my name is Gretchen. I'm a genetic counselor at Johns Hopkins. I've been there for about 19 years. So I've been through the transition of like electronic health systems and different physicians in and out. So I also am fully aware that like many people have limitations in being able to go and travel to like a specialty center. And so I do field a lot of questions about like, I can't come to you, but like, how do I build a team where I'm at? And so I'm just excited to kind of share some of that advice along with the panel tonight to y'all. Yep. Angela, you're muted.
Wonderful. We are always so fortunate to have you in our midst. And I'm grateful to you as always. That's why I am muted, because I'm going to get these things come through. Okay, so first question I want to ask, I'll present this first to Gretchen and then we will serve it around the group. And so you can look at this from a patient perspective. You can look at this from a, whatever perspective best fits how you want to answer it. But this was something we hear fairly often, and it relates to all the conditions, and that is, how do we, the asker put politely, update our physicians on the most current research? And to go along with that, are there local experts that we can connect local doctors with? Is the Marfan Foundation or Loeys-Dietz or VEDS movement, are there resources there to help? I can help answer this, but I will give that to you first, Gretchen, and then circle back.
Yeah, I mean, I think clearly the Marfan Foundation and all the different subgroups have a lot of good communication about the newest research and kind of guidelines and how to take care of people. And I always think when you're going to a doctor, like that's more powerful than like, oh, I saw this on Facebook and someone posted this. So I would, stick to kind of wanting to address topics and themes that came up from the medical providers through the Marfan Foundation. I'm also a really big proponent of like, if you have questions about a new medication or about like screening, as much notice as you can give your provider, like the nurse or the person that works with them, to give them a heads up about things that you'd like to discuss, like a paper that came out or something that you'd like to discuss. If a doctor has a little bit more time to prepare or ask questions of their colleagues rather than just being thrown a whole bunch of articles like right when you walk in the door, they're probably going to be able to do that homework for you more. And I guess I would say, there is this balance of like being assertive with your physician and also being kind to your physician. Like they just might not be up on the latest research, but they should be happy and grateful to kind of walk through that with you. But I think it's also fair to be like, if someone is just blowing you off when you're bringing up guidelines or things like that, to really assert yourself and be like, is there other specialists you can consult with? Like, are you able to read this and get back to me? And what's the time frame for that? So kind of pushing your physician, I think, is feasible too. And then, Angela will talk about this, but, there's Marfan Foundation PAB members all over the United States. And most of them, their information is online. I'm definitely not suggesting that individual patients reach out, but most of the centers are amenable to like physician to physician contact. And if your home physician is open to that, you can always encourage and say, hey, would you be willing to reach out to one of these specialists? There's no harm in asking to.
I love that suggestion, like, would you be willing to talk to this person? Would you be willing to read this ahead of time? I think that's great. Andrea, do you have any thoughts you'd like to chime in on? I'm just going around my squares here. So if you want to do a quick intro of yourself, and if you have anything you'd like to add from your perspective on that question.
Absolutely. So my name is Andrea, and I work as an assistant clinical research coordinator at Stanford. It's a long title, and so I work actually with, I collect a lot of reports and things on our Marfan patients, Loeys Dietz, EDS, et cetera, et cetera. So we do get a lot of emails from patients asking about the latest research, or asking about, a lot of them have had cardiac surgery. All of them that I work with have cardiac surgery. And so a lot of them are asking about any updated research on this, asking from their physicians, their surgeons, to give to their at-home physicians. And I think that that's a great way, is if you have a surgeon or a cardiologist that you trust. A lot of our patients might have a cardiologist at Stanford that they see, once every couple of years, but they have a local cardiologist or a local physician. And so somebody that they can contact and connect with for the latest research to give to their local physicians is definitely really helpful. But as well as talking to your physician about how is best to contact them with latest research, that might be a great option. And then in my experience, some of the best physicians I have had, I've been to a lot of them that don't know about Marfan, maybe don't understand it right away. And so that can be a little bit hard for me to immediately trust their recommendations. Sometimes I might run those recommendations through one of the professional advisory board members, just to make sure, especially if it's anything invasive. But some of the best physicians I have had go and they do their research after the appointments. An eye doctor I had in Reno did the same thing. He ended up going to dinner with a bunch of different optometrists and discussing my case with them about surgery, HIPAA compliant, but discussing my case with them, and coming back and saying, I talked to all these physicians about your condition. I'm not incredibly aware, but I'm learning a lot more about the different procedures, why these procedures might not be recommended. So I think just trying to have an honest conversation with that physician about what they're comfortable with in terms of you sending them research, and also sending them to the Marfan Foundation's website, maybe getting them in contact with the professional advisory board member, I think is really good.
So Abby, thank you, Andrea. Abby, I know you come at this from a slightly different angle because it is not you affected, but your child, and you've had several years of practice at this. I'm sure you've had your share of frustrations and hopefully some wins as well. Although there isn't quite as much research around VEDS as some of the other conditions we're talking about. So I'm curious about your experience on this one.
So my name's Abby. My son, I have a 9-year-old that was diagnosed with VEDS when he was 2 years old. So I'm going in about 7. We've known about it for about 7 years. So I'm involved with now the VEDS, the VEDS movement. I do the steering committee. I'm also involved with the VEDS collaborative. And I've been able to really meet a lot of people, and I would say the way this area kind of resonates with me. So I've learned over the years, we have a really good care team for him now, but I've learned over the years, you may have doctors that you can politely, give the information to, or, refer them to the websites. But if it gets to a certain point where you feel like you're really not getting anywhere and they're not understanding, the diagnosis, there may become a point where you just do have to move on and find someone new. I've also learned I've learned this a few times. You can be in the right center, so at the right hospital, in the right clinic, but with the wrong physician. So you may not have the doctor that is, specifically working with VEDS and really, has some patience with VEDS and has some experience. And they don't always have to have experience. We have a pediatrician that has never, had a VEDS a VEDS kid, but over the years, I mean, she's really, like taught herself and reached out and learned a lot about it. So that's just, that's kind of a different way to maybe to look at it too.
I like that advocacy side of you. I can feel the, like I'm sure I can sense that you've had to do that, and I'm sure it was never easy.
No.
But sometimes you got to make that tough decision because you got to get the answers that you really need. Courtney, so you wear kind of the dual hat here of both having probably experienced some of this personally and potentially even some from the professional side. So if you wouldn't mind introducing yourself real quick and then sharing your thoughts on this.
Yeah, so my name is Courtney. I'm a genetic counselor at Duke in pediatrics here in North Carolina. And I had my Loeys-Dietz diagnosis in the original group of like 50, 60-ish of us before it was really even a thing. I've known that I've had Loeys-Dietz since 2005. And it's been a journey since then, a lot of figuring things out as we go, but certainly hopefully I can be helpful with the perspective of a provider and a patient here. But specifically for this question, I think that, going off of what Abby said, there's a good fit for everyone. You might not test drive the first car and buy it. There's a reason why there's different makes and models. And I feel like that can also apply to fits for your communication style and your family. And as far as providers go, like Abby said, sometimes you're in the right place and at the right hospital. You just got to kind of find your right provider. And I've definitely had experiences with that before. And I've politely addressed it and said, I just don't feel like this is a good fit for me, but I'm really comfortable here. What can we do? And not necessarily to that doctor themselves, but whoever referred me there or suggested that. And a lot of times they're open to saying, okay, so what wasn't a good fit? How do we address this? What are you looking for? What's a better fit for you? So I do think it's a personal experience for each person and finding that fit. And then the other thing, kind of tying in, how do you stay most updated? So speaking from the genetic counselor and the person who works in genetics, obviously I'm biased. But do not fear genetics after you get your diagnosis. Sometimes it can be helpful to check back in with genetics, and that's what we suggest for most of our patients, is because that is a time where we can make sure you're plugged into your providers, but it also gives us a time slot to say, hey, let's back up, and how long has it been seen since they've been seen by genetics? Are there any updates? And that's our time to go through the research and the literature as well. So I think a lot of people get their diagnosis and they're like, oh, I don't need them again. But a lot of times I think we are utilized as kind of a point of contact to, are there any updates? Is there anything we can do? And I'll say probably 20% of my cases a week, it's someone who's had their diagnosis forever, but they're coming back to see us to make sure that they're plugged in and that they've got everything covered and that they're up to date on their condition with any of the topics or research that's going on. And that's part of our case review and our case prep.
That's great to know. I'm not sure that would be super common knowledge that the genetic counselor could be that point.
Yeah, so I know not everyone has genetics locally, but sometimes it can be something that you can plug into your schedule every couple of years. I don't feel like you need to see them every 6 months to a year like we're used to seeing cardio or other providers, but every couple of years it can always be good to touch base, and that could be kind of more of your staying plugged in. And then the genetics providers usually are happy to write that in their notes, so that can be referenced by other providers as well.
That's great. Thank you for sharing that. Coming out of that question, then there are a lot of questions that came through about trying to help providers coordinate your care or coordinate your child's care. And so I'm going to toss this one back to Gretchen to start again. I know you had several notes that we had shared earlier about how do you help coordinate communication across health systems, hospitals, medical groups. Sometimes, like we mentioned, it may not be provider specific. It could be more of system level. And then sort of the subcategories of that we'll get into then are talking about like how to get, if you feel like what you really need is a referral, how do you ask for that so that it can be heard and be done? Or how do you, get, not only have folks coordinate effectively together, but make sure everybody who needs to be coordinated is all pulled in, right? Like if there's another specialist that really needs to be a part of the equation, how do we make sure that they are there? It's a big question, but we've got
like 7 questions in there.
There you go. Sorry.
You know, I think some of the biggest thing is like, don't make assumptions, is like, don't assume that records are being sent, that images are being sent, that even though we have this electronic health system and it's all Epic in some institutions, that all the Epics can see each other. Like, I know many people are familiar with having their binder of all the information, but it is true is that, you know, a lot of times you have to kind of be your own quarterback in terms of carrying things with you. So you don't show up at a doctor's appointment and assumed they got the record from ortho, you know, 3 months ago, is really being a collector of your own information. And again, like through Marfan Foundation, Backpack Health is an excellent, you know, platform for that. So one, I think don't make assumptions, like try to collect all the data yourself. And I think also it is a lot of communication and asking, like, what is the best way to get it? Like, who is CC'd on my list? So who, you know, if you've been at the same doctor for 4 years, but you have 4 new doctors, they might be sending letters to the doctors you saw 4 years ago instead of your current list. So that kind of logistical stuff. And also, you know, just asking questions about like, are there certain physicians that you have case conferences with, or that you work well with or communicate well with on a regular basis, just to kind of learn the systems of how people collaborate and how they share records, I think are some big tools that people can use.
Are there any things that you see, aside from keeping on top of your own information, are there any things that you see that people, you know, we get frustrated, we get overwhelmed? Like, what are some of those common pitfalls that people fall into when they're trying, they need to be able to do this coordinating, helping themselves, but, you know, they maybe get stuck?
Yeah. Well, and I think sometimes even, I'll be honest, we get stuck because if we're sending to a new department, you know, like some hospitals might need the patient to call, or some departments might just need a referral from us, or we need to do authorization. And so I think, you know, asking your provider of like, okay, I'm sending you a referral to ophthalmology. What does that mean? Should I expect a coordinator to call me? Do I need to call? Like, what's the phone number? So a lot of it is like, you know, I call it the wrap up at the end of the appointment, of like kind of like the plan and the action steps to figure out like, what do I need to do? What do you need to do? What's our plan to get this done? Because, you know, and sometimes the doctor isn't the best person to have those conversations with. Sometimes it's the nurse, sometimes it's the coordinator, sometimes it's the genetic counselor. And so making friends with those people who kind of work in the more of the logistics, rather than like, oh, we'll do X, Y, and Z. But like the people in the weeds are the ones who know how to actually get you to the right places and the right people.
I feel like that's always great advice, no matter what type of service or support you're trying to work in. You know, always the frontline people, you know, the people who take your name and your insurance information, they're the ones you need to be friends with. Abby, I'm going to go back around the circle the other way. Would you, you know, what would you add to that, or what have you had some success with, maybe in or maybe not success with in trying to help coordinate across different specialists or systems?
So mainly I try to use the same health system. Like we use Children's Hospital. So that's where most of our doctors are. So as far as communicating, you know, within that system, we haven't had any problems. It's when, you know, a certain specialist is out of that system. But like for an example, we needed a GI doctor, and the one that our pediatrician wanted us to see that she really likes to work with was not in that system. It was in another system. So we went that route, but you know, if your doctor is giving you a referral to someone out of the system, you know, you can probably bet that they're pretty good. Another I do keep really good records. I have a binder. I don't of everything I keep. I don't usually have to take it with me anymore, just for his appointments, because all of his records are up to date and where we go now. But I mean, for example, 2 years ago, I had to we were having some issues getting just his regular scans done. So I found a name of a doctor, a vascular surgeon in a different network. So I just cold call, and I tell the person on the phone, and they end up, I tell them my son has this diagnosis, and then, it turns into, well, we need a referral. But I can I'll just say, well, you need a referral because they have to make sure that he has like a genetic diagnosis, but I already have all of that paperwork. So then I can fax it over, and they can see that, he's genetically confirmed, or whatever it is that they need to verify. And then it's done. So sometimes, even referrals, I feel like it's only because they need to verify that like certain things do need to be done. And if you keep really good records and you have that information, and you don't have to call around, to a bunch of places, it makes it way easier.
That's great advice. It kind of hits on the sort of the sub question about referrals. Have you ever had a point where you were like, okay, we need to go see a fill in the blank specialist, and you just had to kind of ask for it? Or have yours always been?
Yeah. I mean, for the most part, we've had pretty good luck. But I mean, if it's something, that I know like he needs to go see a GI doctor. We've been having issues. Oh, absolutely. I will just come out. I mean, and I do it very kindly, but you can have that relationship with your physician, and, give them we'll give them the details about what's going on. And you can say, I really think he needs to see a GI. And if you have a good relationship, there should be no issue with that.
Yeah, it doesn't seem like it should be any skin off their back to make that referral. Courtney, any different angle or different thoughts you would like to add to that?
So I think that being in the same health system is ideal, but not obviously reasonable for all people in all areas of the country. But that would be my first tip. If you can find providers that are all a good fit within the same system, that's probably a pretty ideal world. But certainly, I think outside of that, like Gretchen said, making sure that all of your providers are aware of the other providers that you're seeing, so they can make sure those copies of the notes get over. The other thing kind of internally is notes seem to get to doctors, but not labs and imaging and scans and other things. So they'll get your actual like clinic note, but they don't necessarily automatically ever, and that's not the doctor's fault, that's just the way medical records are. They're not going to get your imaging and your lab work and your echoes and things like that, because that's separate from the clinic note. So that can be important to make sure you know how to request those and share those or get them, have the plan, ask the provider, I know this isn't resulted yet, but how do I get it so I can make sure that the other doctors are aware of it. So I think that's like a good tip I would have about trying to keep everyone on the same page. And then as far as, if you're able to, again, I'm speaking in ideal terms because I know this is not perfect for everyone, but if you kind of designate that person within your care team, that's your hub, whether that's your primary care doctor or your cardiologist or the genetics team, that when you need a new referral or you're having a new symptom, that's who you go to then they can recommend a referral. So if you can designate a person, a provider in your network as that, helpful, so there's not dual efforts or conflicting referrals or confusion on who's doing what and who's going where. So I think that can be very helpful to try and streamline that, and the provider who might have like the best fit or tips. And sometimes, I'll ask my primary care doctor, oh, I need this specialist, and she's like, ooh, I don't know who the best person will be. ask cardio and then let me know and I'll refer you if you need a primary care referral. But typically it's, for me, historically been my cardiologist who's been my hub. And they'll even refer to like people that are nothing to do with cardiology, but they're just the ones that kind of, I think that's unique to each person's care team, but that would be my recommendation as well.
So your point about that is super well taken, because we've got a couple of questions bubbling up, both in the ones that were pre-submitted and tonight, about like, who is that primary person? And, you know, because there aren't doctors who are just like, I am a VEDS doc, I am a Marfan doc. I mean, it's a team. And, you know, how do you choose that? It really sounds like it's a lot to do with your own style and who you connect with, and which of your care providers is the most invested in being willing to be that hub. Is that a fair?
Yeah, you know, who you have those comprehensive conversations with. I know that for me, when I go to cardiology, they don't just ask about my heart, they ask from head to toe. And that might be different for each person in each visit, but that should be happening at primary care, pediatricians as well in an ideal world. But I think that asking someone point blank is not also a bad idea. Saying, I have a lot to coordinate and it's really helpful if I have one person who I designate as the referral hub or who can help me. Is that you, or should I ask someone else? So you're not assuming anything of anyone. Be black and white. I think that can be helpful for you and the provider to expectation set. And then that way you have a plan and it's not 22 steps to get to one referral. You know, I go to this person, I say, this is why I need this referral. And they say, okay, I think this is the next best step. So that way you don't have to fight the system every single time and recreate the wheel. That would just kind of be my thoughts.
I love that. That's great advice. Andrea, do you have any experience or any other points you would like to layer on top of that?
Yeah, so I have a lot of experience requesting medical records and echoes, which has been my job for 2 years. So communicating with them is difficult. We have even our facilities on our list of, we have to call this facility, but there is, and then also I've taken over my grandmother's medical care now as well in terms of organizing her appointments. And it's been very, very helpful because my mother always did mine for me, and it's been me more pulling away from her, like going to my own appointments, and really organizing all of that myself. And so a few things that are super helpful is when you, or the next time you go to a doctor's office, ask the front desk if they have Care Everywhere. I know that's really popular on the West Coast. And it's just a way for records to be shared with different hospital systems, as well as if they have an online portal for their clinic where you can see the reports, see all the results. That way, if you forget something and you go to a new doctor, you can pull it up on your phone or your computer, and they can read the results right there. Sometimes the full reports are not available on the portals, but at least they probably have the lab results. As well as what I have started to do, and what I've been also kind of encouraging some patients to do, is asking for the echo CDs or your CT CDs. And if they can't have them available that day, ask when you can pick them up, your x-rays, and just kind of having those CDs available, because they're starting to introduce some ways to electronically transfer the images, but sometimes it's not always available. Some places have very, different equipment than others. And so that's some ways that are really, really helpful to coordinate the record aspect. I think everyone kind of touched on the communication, but that's some of the ways I found the most helpful for patients to get answers right away from either their specialists that they're already established with, or when they're going to new physicians. They can have all of that kind of available.
Have any of you used the Backpack Health System or had anybody who does? So this is another thing, I'll just throw it out there. It's a digital version of the binder, and it's available whether you have a connective tissue condition like Marfan or Louis Dietz, or I use it for my kids who are typical in most every way. And you know, it's just nice. I have their vaccination records all in one place. I always lose those things. So if it can be helpful to someone like me who is just kind of disorganized with that stuff, I'm sure that it can be helpful for folks who are, you know, trying to coordinate care across many places. And so I can drop a link for that in the chat. You can find more information about it on the website, marfan.org, but I'll just throw that out there too. I know it can be kind of a heavy lift to move all of your papers. If you've had a binder, move it over. But then, you know, it is literally in your pocket, and you can also create what's called a share card. So, you know, if your child is going to camp or your spouse is seeing a new, you know, I don't know, someone you're caring for needs access to parts of those records, you can give them digital access to specific parts of it or all of it. I know we've talked to parents over time who have found that really helpful for like sleepovers and things, where I just need to know that the parent where my child is staying knows like kind of what's up. They don't need like every detail of my kid's medical records. So just thought I'd toss that out there too, since we're talking about coordinating care.
Another thing I just thought of as well with kind of some things I've noticed when I observe doctor's visits or when I go as myself, is when talking about the specific issues and questions, having them written out is really helpful. And then as well as if you know you have an appointment coming up and there's these things that you want to talk about, also start tracking in terms of pain, tracking when these problems occur, so that maybe you're not calling your physician when it's severe, and to the point where you're waiting for that appointment and they have really more specific questions and you're not able to answer those in as much detail. As kind of keeping track when you know you have an appointment coming up or you've made a future appointment for that problem, take those few days in between that time to kind of track and write down the exact symptoms, kind of the scale of pain. I found that to be really, really helpful.
That's great advice. Okay. Unless we have other thoughts on this one, I know there were a lot of questions in that. So if you have other thoughts or other questions that you'd like us to try and look at tonight around this topic or others that we're discussing, feel free to drop them in the Q&A or the chat. We'll get to as many as we can, kind of balancing what was pre-submitted as well. So the next sort of step of this then is where we see a lot of questions is around finding those doctors. Lots of people submitted questions about living in places where the doctors they see don't know anything, or they know very little about Marfan, Loeys Dietz, VEDS, Stickler. We had a few folks hopping in about that too. In fact, there's a question in the Q&A right now about Stickler. So there's sort of this duality of like, do I know, how do I, you know, these doctors are more convenient. I don't know if I can really trust when it comes to these things, what they have to say. I'm worried there might be something else I need to be doing versus how do I even begin to find another person who might be familiar with these things. And I think it crosses both, you know, your primary care provider to more specific specialists as well. So any tips you have on that, Gretchen, love to hear your thoughts to get us started.
Yeah, I mean, I'll just start with the like primary care physician question, because we get that all the time of like, do you know a primary care or a pediatrician who takes care of Marfan patients? And you're like, you know, that person is not going to exist. What you really want in a primary care physician and pediatrician is someone who is responsive, someone you can get a hold of their staff. They can work with you for referrals and authorizations, like Abby was talking about. You know, there are still, I saw that question in the question list about like, what's the need then for these people? If you have a Marfan or other connective tissue specialist, and like, there's still going to be ear infections, and you're still going to need like routine blood checks, and you're still going to need like adult screening for, you know, just generalized health screening. And so, you know, those people are helpful. And oftentimes, if you're presenting with pain and you're a little uncertain, oftentimes the pediatrician or the primary care physician is your first contact, because they can help you triage a little bit about like, oh, is this something that, you know, I can handle and is maybe understood, versus like, oh, this seems something above and beyond. Like now we need to really get the specialist or their on-call number. But I think someone that you like, someone who's willing to learn and partner with your specialty physicians, is who you need to look for in a primary care physician or pediatrician. And some of my advice there is like, if you're moving to a new area, like ask your coworkers, ask your neighbors, who do they like, you know, like just asking around and trying to find a good, helpful clinic is good. And then, you know, in terms of other specialists who might not be like official Marfan specialists, if you live in a location that doesn't have like a big center or things like that, again, you really want to look for someone who's curious and open to learning and is willing to communicate and say like, oh, I'm moving from this person to this person. Like, can you ask them questions? Can you communicate about my child? Are you willing and open to learn and be curious? I think it's much better to find that person than someone who's like blowing you off because they're like, oh, I know how to take care of this. And they're looking at guidelines from 20 years ago, you know? So I think, you know, there are good physicians who might not just be specialized where all their patient population is one, but they're willing to be team players and listen and learn and facilitate. And I think that curiosity and that willingness to work with you and with your team is very important.
I love that idea of trying to suss out somebody who's curious, because we can't yet rely on there being such a widespread understanding to the depth that a patient is going to need. So we just need people who are willing to be curious. And there's even sort of like a little bit of humbleness in that, right? Like, I don't know everything, but I'm willing to learn and I will go out and look and, you know.
Yeah, and I don't mean like curious as in like, oh, you're 1 in a million and I want to learn off of you, you know, just like curious academically, help you, not to like help themselves.
Yes, very good. I love that perspective. Courtney, you know, kind of also from that, wearing a similar hat, I'm just curious, I'm curious how you might.
Word of the night. So as far as for like kind of what I was thinking of is, first off, I was born and raised in a small town outside of Boston. So I had pretty much every medical center I had within 20 minutes. So I did not realize how lucky I was until I left and went to the Carolinas for my education. And then I found myself training in South Carolina, where my patients were driving 3 or 4 hours just to get to a genetics provider. So that was quite a whirlwind for me, but it has been a great learning experience, both as a patient and a provider. So first and foremost, I think that you have to have a local team. You have to have a team that's accessible to you, and you don't have to drive 4 hours. And that might not be your every yearly check-in, but someone who, when you have an ear infection and it's just an ear infection, that you can go to. Specialist when it's just a routine thing that happens to any person outside of any of these diagnosed conditions. So I think having that team in place locally is really important. And as far as like finding a specialist in your area, I think Gretchen hit the nail on the head. Sometimes you can find people who are at a major medical center and are very well trained, but they might not have that interest in learning more about your condition or helping you. But there could be a local person that is super willing to read up on all the research and try and figure this out and walk this journey with you. I'll be perfectly honest. There are some people in major medical centers that they see rare every single day, every single patient they see. So they do not have time to help all of those people at that level. But if you're one of the rare cases that a more local provider has, they might actually have more time to go through with that and walk through that with you. I know that it's definitely a different take on things, and I totally understand where most people are coming from. But I think that it's a happy medium. I think having those resources where you know how to get in touch with a specialist or someone who might be doing lots of research in that condition or that area, but also recognizing that it doesn't have to be at a big name facility that you might be able to find help. And help in this journey. And it's kind of going back to finding that right fit and provider. And on a second note, I'm really hoping some good thing out of COVID is telehealth. I'm really hoping that helps these people out, and this changes some things going forward. So that might be a positive that came out of this whole escapade of a pandemic.
Seems like it certainly has opened up it's created some openness for discussion about it, where maybe it was not as there wasn't as much interest before. How about that?
It was a forced trial, and I don't think it was as bad as some people thought it was going to be. I think a lot of positive came from it. So I'm hopeful for the future.
Very good perspective on that. Courtney, I'd also love to ask you, just to pick at you here but a second longer, because you both work in this area and mentioned that you've done this, where we have a parent who had asked a question about transitioning from pediatric to adult care. They say, we have a cardiologist, but need a PCP familiar with Marfan, sub any of the conditions in there. I think, how should we go about finding a PCP in a new area? And I don't know if this person was moving for college or what, but there was, sort of this allusion to, we're moving to an adult care. We have our cardiologist. Sounds like that main person is still in place, but you need this.
Yeah, so it's hard. I definitely had a rude awakening when I switched from the children's hospital with musical steps to the adult world. I was at 26 years old, my providers were like, you have your own patients. It's time for you to get out and go to the adult world. So I totally understand the struggle of transitioning, because once you're comfortable, you're comfortable. But as far as trying to find those providers again, because you're kind of going through this process, my recommendation would be to work backwards there. If you have a good relationship with a cardiologist, who do their adult patients see in primary care? Is that someone that you can reach out to and would be helpful for you? So kind of work backwards. Again, is that the person that's going to be your hub? Can they help you identify those other people in your care team? So that would be my recommendation there. And then, ask the pediatric provider. When your patients graduate, who do you recommend? Because they're dealing with that all of the time. But I think that also when you're changing providers, and that's at a big point in life, when you make that initial appointment with a new provider, always giving them a heads up of, hey, it's going to be a lot to go over, and understanding that this might be a growing experience for both of you, and you might not be able to have all of those answers and that great fit and great visit first shot. So in a 1 hour visit. So also keep the expectations in the transition and know that this is a transition and it's not going to be perfect overnight.
Love that perspective. And I think it was you who shared earlier about, if you're moving to another city, ask your employer. If you're changing jobs, ask the employer. I think the same could be said for if you're starting school somewhere, or, generally speaking, when we're relocating, we have some kind of hub of people, or at least knowledge that we're moving into. And, you're probably not the first person who's moved there that's asked questions about setting up new networks of support. People move to our area and they're like, I live really rural, and people move here and they say, how do you get internet? That's how rural I live. So, but you ask around, and it might not be, like you said, it might not be the best fit right out the gate, but at least it gives you a starting point to know. I mean, there are doctors there. It's just a matter of figuring out which ones are going to be the fit for you. And whether you had a direct referral or not, you're still going to probably want to try the person on to make sure it's going to be a fit one way or the other. Andrea, how about you on this one?
So my team has been pretty established for a long time, thanks to my mom. And I'm sure, Abby, you have some of the same experiences as my mom, but she has told me many a times that when I was transitioning from pediatric to adult care, they didn't know where I was going to college. And so she called and made set up meetings with various cardiologists in different areas of the country to basically interview them. and asking them questions about what she thought might be the right fit. I didn't know about this, and then when it kind of became clear that I was going to be on the West Coast, then she kind of started narrowing it down, and she thought many of them were fantastic, but she had a list of questions and things that she wanted to make sure that could be covered either at that medical center. Could something be a hub for me? What is the distance between my college and this medical center? So, and I know that she did that in Anchorage a little bit as well, in terms of talking to the different providers and then kind of creating a network for me. So now, I feel very lucky. We were able to travel outside of the state, outside of Alaska, to either Seattle, California, for my care, but also having doctors here in Anchorage that were well-versed on Marfan, or if they didn't know, they had contacts out of the state that they could contact, as well as just kind of this network for me now that I know I can go and I know the doctors I can contact and what really they're good for in the nicest way possible, that I know I can go to my general practitioner for everything that is general there, but I'm not going to ask him to look at my echoes. He's not going to keep track of any of that, and that's okay. And so that's kind of what I found. She did a great job of doing that, and so I have to commend her efforts, because I know it took a lot of effort and a lot of trying, of talking to various providers. So
thank you for that. Shout out to the moms. Abby, you're up.
Andrea, she just gave me a great idea about when John goes to college. So calling for interview.
I didn't know about any of this. I also, when I went to my new cardiologist, it was a little traumatic. Unfortunately, it was my first appointment with my adult cardiologist, and I found out I had to get aortic surgery 3 weeks after that, like within 3 weeks. So, but she signed up for all of the online stuff under her email. So I still log in. She still gets with her cell phone.
Eventually it's going to be your doc saying you have your own patients now. You should probably start using your own email to log in.
So we have a great relationship.
So I love this question and this subject, because so my good friend Katie Wright at the VEDS movement, I did a podcast with her before COVID, back when we were in Nashville together, and the first thing she said was, "You're in an I state." So I'm in Iowa, in like the very corner of Southwest Iowa, and there is nothing. There is nothing. To put it in perspective, our local hospital, we have one general surgeon. That's it. There's no specialties. I mein, once in a while they'll have, a cardiologist come down from the city. So in our area, I have to travel just at an hour just for a pediatrician. So getting even to, the big hospital that we use is in Omaha. So it's right at about an hour and 20 minutes. And we do have a good team there. It's definitely not a huge medical center. And I have been fortunate to be able to travel to Baltimore and to Houston. And so our local cardiologist, she's great. And if there's ever any questions, she can email, our doctor in Texas. There's always that communication. But, sometimes you might, in certain circumstances, especially for me, it's just not feasible to have someone. I mean, you may have to travel a little bit.
And that kind of circles back to Courtney's point about telehealth. I know there are certain things that we just are always going to be more difficult to do via remote, but more and more there are things that we can do virtually. And for those of us, and I will say those of us, Abby, it sounds like I put in the chat, okay, like an hour to the pediatrician is more rural than me. You take the cake on that one.
It's like highways. It's not, I mean,
yeah,
you're taking three highways in an interstate.
Some people, I'm like, that's country driving. That's not like city
right. No,
driving.
no, you're driving like 65 miles.
So on the flip side of that, I was very close to Boston, like within 20 miles, but to get into an appointment, we had to leave about 2 to 2.5 hours.
Oh my gosh.
For rush hour.
It's
like not even
crazy.
Kidding. So pick your poison, maybe. No, I'm just kidding.
I guess I'll take the scenery.
Yeah. If that ever makes you feel any bit better. Probably not, though.
So I want to touch on just one more little aspect of this, and maybe Gretchen, if you would like to take a stab at it. We are increasingly getting questions, and this is great because it means more people internationally are getting connected with us, but we're getting more questions about how to connect docs who are from people who are international. You know, we're mostly based in the US. We're really trying to be more cognizant of supporting people across the globe. But this question is an important one, and one that we, you know, have not tackled quite as thoroughly. As I did put in a link in the chat to the Foundation's clinic directory, where you can look and see where we have sort of centers of excellence, or those where our PIB are located, or where we know there are a concentration of professionals who have some experience, at least working with people with these conditions. But internationally, it becomes a little bit more gray. So I'm just curious if you have some thoughts on that.
Yeah, so I'm gonna answer that question, but can I just circle back to one thing? I just wanna say a word about like telemedicine and telehealth, because I think it's super awesome, but I just also wanna put kind of, there's some realistic limitations, because I know we've gotten a lot about like patients from certain states being like, oh, we can just do telehealth now. But there are a lot of restrictions in terms of licensure and what states that different providers can practice in. And during the COVID pandemic, they like kind of relaxed some of them depending upon the state, but there's still paperwork and, you know, billing issues. And so, again, just ask questions, don't make assumptions, because sometimes, you know, unfortunately, we would love to be able to provide telehealth through everyone, but like, there's just a lot of, hoops. And so, you know, I know Marfan Foundation is a great place for advocacy. And that's something that definitely, you know, with the healthcare changes that might be happening in this country, we would love to see, to be able to provide more care, but just realistic expectations and about telemedicine is important to keep in mind, that the floodgates haven't opened and you can't see whoever you want, whenever you want. That being said, internationally, we get this question a lot of times, especially because a lot of our like young adults maybe want to do rotations overseas, or are traveling for school, or, you know, volunteer or fellowship grants for a year, things like that. You know, I think like Angela said, like the Marfan Foundation has great resources. But again, I think a lot of the PAB members, we get this all the time, you know, like we're constantly going to seminars and research conferences that involve our international community. So I think, you know, always asking someone, you know, on the PAB or your own physician. And then, you know, clearly there are Marfan foundations based in other countries. And I, you know, and again, it's that same answer of like, well, ask your neighbor, ask your friend, you know, on the Facebook pages for Lois Dietz, for Marfan, you know, there's a lot of international community there. And they can also give you good advice on like the centers in France or Australia that they all know about, but that is going to be new to you. So it is an area where maybe crowdsourcing is okay.
I will say too, to that question, because there were a couple of folks who asked questions of that nature, of the different conditions, actually, not just specifically Marfan at all. And each of the divisions, we kind of have different contacts in different countries. So, you know, it sort of depends on where you are and what would actually be local to you, but please do reach out, you know, reach out to Jan or any of us individually. I know we have a member of our board at the Lois Dietz Foundation that is really good about some of our international contacts. And we also have Gretchen on our board. So, I mean, like, we're pretty, we're pretty hooked up.
The man behind me who's hooked up that I can just ask him.
Dr. Google back there.
I say the big man, Dr. Dietz, but.
Oh, Dr. Dietz, yes. Bigger than Google. Okay, so last kind of chunk I want to hit on is about being heard. And this can be tough because listening and speaking, it's a two-way street, right? So we can only control what we put out there and how we receive it. A lot of questions around pain and having that be taken seriously, or having it be considered in a way that that it moves us on toward some kind of treatment or acknowledgement of it. And specifically, we had a question come through today that I thought was really poignant, and that the person who asked was talking about, how do I get my doctor to see that I don't want to live in pain all my life? Like, we can accept a certain amount of chronic pain comes with some of these conditions, but this person said, my doctors chalk everything up to Marfan syndrome and tell me for the most part that I'm just going to have to live in pain. And I shared with you all ahead of time that just really broke my heart. So I would love for there to be some kind of answer to this, especially around pain, but also just like how do I make sure I feel like I'm being heard, sort of above and beyond some of the tools that we've already talked about. Gretchen, do you want to kick us off there? And then I'm coming to you, Andrea.
Well, I was going to refer back to what Andrea said earlier. Like, I think keeping a diary, but also kind of having that objective data of like your symptomatology in terms of how often does it happen? When does it happen? How long does it happen? Describe when it happens. Are there triggers? What makes it better? What makes it worse? What treatments have you tried that have been successful? For how long have you tried that? I think coming in, having that objective data, because pain can be really emotional too, and can be all encompassing and overwhelming. And so having that specific information, we got really good advice from the pain management physician at the Marfan Foundation a few years ago, is also talk in terms of like functionality and goals of like, what could you do that you can no longer do? What would you like to do? How would it improve your quality of life? Because then that can help the physician figure out, okay, like if your goal is more mobility, or if it really is to decrease pain, like there are different strategies that might help achieve that goal. And also, I think some people are afraid of pain management, or give it a shot once. And again, I think a pain management doctor has to be the right fit, as we've been talking about for you, but it is not a quick fix, and it's a long-term, slow process to develop that relationship and develop multiple modalities and strategies that would work with the different types of pain that you're having going on. But I think, those would be some strategies that I would think about. And we all want, I guess this is my other piece of advice, is like, it is also a two-way street. Like if physicians are giving advice about trying to get to water therapy or trying to do weight loss or some of these things that we want patients to be trying, it's also important to be motivating and do that as well, if that's a sensitive way to say it. Like you have to be a partner to try to make your life better and take the advice that they're giving you as well.
That's a great way to start that off. Andrea, I'm going to come over to you because I was thinking the same thing that Gretchen said, like sort of ties into a little bit of what you were already saying, but I'm sure you can build on that.
Yeah, absolutely. And I think that Gretchen hit on a lot of the points I wanted to talk about, but also that, especially from a patient's perspective, is for a long time, I always scaled my pain on I've had a lot of surgeries, so like many different levels of, oh well, this is fine, it's everyday normal, and I've gotten quite a bit of a reputation now with my doctors for hiding pain and not intentionally. And so really now I've started to communicate that my pain is real and how can I manage it, and that it might be a long-term that some of these goals will be long-term. A lot of the times we want things fixed very quickly or surgically, and that just might not be the best case. Just like I can't work out like crazy, so getting in better shape is going to take me a lot longer, but it's going to be over a prolonged period of time. The same thing will be with pain management. And so I think I've kind of created that as a good mindset, that there's still going to be bad days, but working towards those days, and then better days and ways that help, as well as communicating with the physicians. Again, that question is heartbreaking, that a physician is maybe not listening, and maybe those are not the right physicians. Again, if you're going to them and you're communicating, these are my goals, and I don't necessarily expect that all of my pain is to go away, but I want a better quality of life, and how can I get there without surgeries and more therapeutic, and they're not listening, it might be time to go see somebody else and get reevaluated. Because communication and listening is a physician should be able to do so, and then help in that way. So
that's good stuff. So Abby, for you, this is sort of like secondary, right? So we're not communicating your pain directly, or your, whatever it is you're trying to have your child be heard. It's an even different type, and perhaps even a more tricky hurdle, because it's all, as we've said, like it can feel sort of subjective. So I'm anxious to hear your thoughts on this.
Well, so the easiest way I found to do it is I just keep really good records. So if he's having specific symptoms, I write everything down, how often it's happening. So for instance, he was having a lot of GI pain. So I started keeping track. Okay, what is he eating? What is it happening after he's eating certain things? Is it happening a certain time of day? Is it and really trying to break it down to make it easier to maybe try to pinpoint what's going on, and describing the pain, and I think for a child it's harder, when they just say like, oh, their stomach hurts. But really try, how does it feel? What is, and trying to really break it down for the physician. But if you have this information and you're going over this with your doctor, and you're kind of just left with no answers, I feel like at that point, you really need to have a heart-to-heart conversation with your doctor and just say, where do we go from here? If your child is having pain and these are the symptoms, this is what's happening, what is our next step? And if there is no next step, it's time to move on and get help elsewhere.
How do you manage that too? Because, with kids, and Courtney, this will be a good one for you too, because I know you work on the pediatric side a little bit, not necessarily in pain management, but, with kids, it's everything is their belly hurts, right? Like they don't know how to communicate their pain. They don't know how to communicate their symptoms in some way. And we're dealing with really complicated symptoms in these conditions. So, how has that helped you refine? I mean, I know keeping track of things, but like, how do you do that when you're trying to translate for somebody who really can't communicate their own feelings that well?
So can you guys hear me okay?
Yep.
Okay, perfect. Just making sure I'm back in live. So as far as thinking through how do you kind of communicate that in the pediatric world, well, how I try and suss out how it's affecting a child is, are they complaining that their tummy hurts and then going run outside and play with friends? Or are they having time that it's taking things away that they genuinely enjoy? And I think that can really tell you a lot about a child's experience, because a 7 or 8 year old should want to play outside or swim in the pool or do those things. And if that's bothering them, that can kind of be a way of gauging and communicating that. Instead of saying, oh, his stomach's hurting him all the time, saying, he's complaining it hurts, and that's taking him out of doing this. And I know that he loves that. so it must be really bothering him. So it's kind of taken away the quantity and qualifying the pain for like, it's getting to this point and it's affecting them in this way. So I think that can be a helpful tool for monitoring a child's pain level as well as a parent, and also communicating it to providers by saying it's hindering them from doing X, Y, and Z that I would expect would be something that they would want to do. And then, you know, you sometimes might see your kid still doing those things, but it's with a limp and it's not as fast as they wanted to be, or, you know, not on their A game. And we don't all have days that we're going to be on our A game. There is a baseline acceptance that there's going to be aches and pains along the way. But I think certainly that's a good way to try and navigate those waters in the pediatric world. And then, you know, just from a general standpoint, I was thinking about this question, and I am one of those people that did not acknowledge symptoms for pretty much my entire undergraduate and graduate careers. I just was like, oh, it is what it is. We're just going to get through this. And so now that I'm kind of reconciling, resetting up adult providers, all of that, I'm realizing that I have a long laundry list of things. And so I think that when you're going to these providers' appointments and you have this long laundry list, one, having those questions that are really important to you to make sure you get answered that day. And then also I know it's really hard, but try and pick your biggest pains or your biggest problems or your biggest hindrances and make that the goal for that visit. If you come at a provider and you list 22 things, they can't fix all 22 things at once in that 30-minute or that 60-minute slot. So yes, we recognize that these are whole system conditions and that there are symptoms in every single area of the body. But at the same time, when you go this big, you can't fix this big all at once. It's almost like you need to kind of take a piece of the pie and then try and make it the whole pie all together over time. So that would be my biggest piece of advice, is try and tackle a couple things at a time, because you just can't be efficient and get anything done if you divide up too much.
I love that. That is really great perspective, because I think that also dovetails into, you know, we'll often see, especially around the issue of pain, where it starts to become not just a physical pain problem, but starts to really affect people's mental health as well. And it's kind of, I would assume, sort of some of the same advice in that we got to make it a little bit more concrete, very specific. This is what I want to be able to do. This is what I'm not able to do. Any other quick thoughts on that, you know, communicating those kind of issues across providers?
Yeah, so I think that's also taking that same approach of making these tangible goals and not just walking into your provider's office and saying, this hurts, this hurts, this hurts, this hurts, this hurts across your entire body. Trust me, I get it, it hurts, I'm there. But at the same time, we can't fix all of that all at once. So if you say, this is what's really bothering me, this is what's impacting my daily life, and is spot number 1 on the list to tackle, can we start here? And then let's try and put 100% or 70% of our efforts on both ends to that goal or that pain or that problem. And then once that one's kind of well managed, move on to the next one. But if you're kind of throwing 10% at 10 different things, you're never going to really see a result. So I think that having those tangible, this is what's bothering me, this is where I'd like to be, exactly like Gretchen shared that the pain management teams have shared. I think that applies not even just to pain, that applies to symptomology in general, of this is impacting me in this way. Exact way of saying, clearly this is affecting their ability to do X, Y, or Z, and they love that. How do we get them back there?
And I'll just add, like, there is, like Angela, like you were saying, that mental health component to that. And I think those are very intertwined, and you should also like really ask your doctor questions about, like, I'm feeling depressed, or I just don't sleeping a lot and I can't get up. Because all of that is so intertwined, and all of it needs to be addressed.
Any other thoughts, points you would want to make? Like if you had a friend who was new to a rare condition like this and was asking you a question about how to how do I make sure every single one of all of these visits, I just get every ounce of benefit out of it as much as I possibly can? You know, are there any other little bits of wisdom that you would offer to them that we haven't already covered? I'll just kind of open that up to the floor.
I would say is using all of your resources. If you are newly diagnosed, and I know that it is a 1 in a million, but my best friend since I was a child just got diagnosed with EDS. And so it's very odd and new, but we, so a lot of the things that you know, have been helpful is finding as much resources as we can to bring to those new appointments, and or already established providers, and trying to get the most out of those appointments, and then really organizing the questions. And I think that a great point was made by Courtney is really organizing the biggest problems first, and then at other appointments you can start trickling in those other kind of smaller issues. I think that's the best way to, you know, to make use out of those appointments. And then also asking what is the provider's best form of communication outside of the office? Is it through some places use My Health, some providers never check the My Health messages and only use email. Some providers hand out their cell phone numbers, so and say call me anytime. So whatever is the best communication outside, I think asking that question is great. And then being assertive about concerns as well. I think that was kind of a note about how to help determine if a surgeon is qualified. It's okay to be assertive and ask for, you know, how many patients have you seen with my condition? How many patients have you operated on? What have been the biggest issues for patients with my condition that you've seen? And if they haven't seen those patients, you know, what is your experience? Have you even, so I think those are all great ways to make the most of the appointment.
Oh, Gretchen.
I'll say like 2 words, like be prepared. You know, put effort into thinking about the appointment, what you need, what you want to get out of it, in plenty of time before the appointment so that your needs are met.
I guess I can speak on as far as if I were to meet, as far as like for a VEDS diagnosis anyway, when seeing a physician would be one of the most important things would be to have a plan in place. You know, who do you in case of an emergency, who do you contact? Who, you know, are you calling the office that they have a 24-hour line? You know, where do you go? Who do you get a hold of? And then the other thing would be when you are seeing new physicians, you really need to make sure we will have doctors tell us they have 20 EDS patients. And we are not the same. The vascular EDS is not the same as other EDS types. And so you really have to make sure that the physician understands the difference between the other types and the vascular type.
That is really important for VEDS. I know that's a common frustration that we hear. Any other thoughts you want to add?
Yeah, so I think just going off of what Gretchen said, be prepared, have your target prioritization of your list and your questions ready. I am definitely a person that can get into the appointment and then forget everything that I thought I wanted to. So I keep a note section in my phone now. And so when I'm thinking about something, whether it's at midnight or I'm walking out to the parking lot, I can write it down because I will not remember anything. So I think that's really helpful. And then just your providers are humans too. So always remembering that they can't know everything. They can't do everything. They can't fix everything all at once. So it is a growing relationship for both of you. And I think for the most part, just always remember that I don't think there's anyone that goes into the medical field that doesn't want to help people. So certainly always remember that humans too.
I love that. Yeah, we forget, don't we? I just want to wrap up quickly, first of all, by saying thank you so much to all 4 of you. I know that this is a chunk of time out of your, your evening or your afternoon if you are, hanging out in Anchorage or your late afternoon. But I just thank you so much. Truly, I know that this is something that so many people in our community are going to find a value for a while. The recording of this will be shared with everyone who signed up, and then it will be available online on YouTube after that too. So no matter when someone is asking this question, this will be available to them, and I'm certain it will continue to be helpful. If your question was either not answered in this session or it comes up later, or you just want clarification, please, I don't just say it because it's the thing we say, we really mean it. We are here for you 100%. That's why we exist, and we like that. Like, we want to help. So please contact us, marfan.org/ask. Usually within 24 hours, someone is back with you, sometimes on the phone, sometimes via email, depending on how you prefer to communicate. Please get your questions answered. If you can't get through to a provider, or you just need help, with some of the things that we talked about during this session, or something else entirely, please use this. It is why it exists, and it makes us, this is why we're here. It makes us happy to be able to help, because we want everyone in this community to have the information that they need in order to be able to live their best lives. And then finally, I also just wanted to share some upcoming things. So February is Marfan Awareness Month. All of our conditions, we have our months, but February is Marfan Awareness Month. And as part of that, we have a lot of things going on, including a cardiac/aortic surgery series. So there are 4 or 5, I forget, cardiac surgery webinars in February with some of the, the world's leading experts on these topics. So you can find out about that on our website, marfan.org, and also just some ongoing things that I just wanted to toss into this group. Teen chat, game nights, every other week. There's one of these, there's a group, they get together. It's different kids sometimes it's some of the same. If you have a child who's in that teenage, or, if you're listening to this and you are a child who's in that, you are always welcome. It's open to all conditions. It's just kind of a nice place to hang out and, be with other people in your kind of life stage and who get it, who are growing up with a condition, connective tissue condition. And then also just want to throw out there too, there are virtual support groups for all conditions. There are specific ones for VEDS. And then on the Marfan website, there are ones that are, there's one specifically for Marfan, but the rest are open to any. We do have several folks with Loeys Dietz, especially, who attend those groups. Everything from aging with a connective tissue condition to specifically like COVID related, like, wow, this continues to be really hard, especially for people who are working through, living with a chronic pain, or trying to see a lot of specialists during a time when really we don't want to be in public as much, just those kind of things. So please do take advantage of these if they sound like they might be helpful to you, or share with a friend who they might be helpful for, because again, that's why they exist. And if you don't know where to turn and you don't know what any of this means or how it fits in for you, marfan.org/ask. So with that, I will wrap us up for tonight, unless anyone has anything else they'd like to share. But what a wonderful conversation. Thank you to all 4 of you. Just such generous souls, all of you. And we're grateful for that. Anything? We good? Oh, and we got a little dog tail wagging there. Yes. It's officially a webinar once you've had a dog
here. Now the dog's coming in. We're like, game over.
The pets are done. We're done. All right. Have a great evening, everyone. Thank you so much. Bye.